and I will
Yes.
go into presentation mode. It's a case report that's a recent case just from this week. That's who the patient came for follow-up. I'm from Indiana University, School of Medicine at Midwest Eye Institute. That's our institution in the background. I've been here about 22 years. And we take care of a lot of patients who come with unusual symptoms, like all of you do. Floaters and glare for 2 years, 64-year-old female. She's good weight, height, standard Indiana sized lady, history of high cholesterol, hypertension, rheumatoid arthritis, hypothyroidism, Sjogren's, and she's on multiple medications, at Plaquenil for the last 5 years at about 400 milligrams a day. And then this is what happened when she first came in. She has, you have a color, I'm sorry, you have a, autofluorescence image in the middle and both the right and left eye. She has a little scar at the bottom, an atrophy, peripapillary atrophy, maybe what you might think of as some other changes. And then the fellow eye has mild RP depigmentation near the center. This is a blue light autofluorescence image. Unlike the standard autofluorescence image on the Heidelberg, this gives you a little bit more of the black in the center, which is normal. And you're looking at cuts on what the OCT might look like at different places. This is her multifocal ERG when she first came in, which was February 1st, 2019. And you can see a diffuse decrease in response all throughout. You see a moderately severely reduced peak in the right eye, slightly more reduced peak in the left eye, good quality image, and what I call really a perifoveal significant loss. So there's generalized depression, but you can see that the responses on the outer ring, ring number 5, look pretty decent, but all of the rings in the center look significantly down. And then 1 year later, she comes back, and actually the responses improve. Part of this is an old EDI system machine, that original one that was developed for multifocal ERG, and this one developed by a different company from Diagnosis. And the quality of the image is actually much improved. You can see that the central peak is actually improved. There's a slight delay if you're looking at the ring 2 averages. And that's what I often look at, because often early signs of retinopathy can show up like that, where there's a slight delay in ring 2 and ring 1. Ring 1 is less reliable. It's because it's only based on one central response. And if a patient's fixation is lost, you can't follow that response over time. Ring 2 and 3 and 4 are far more useful for that. So I look at those. There's a slight delay in ring 2, but not actually as much. Ring 3 looks fine. Ring 4 and 5 looks good too. And if you look at on the right side what the 3D representation looks like, this is a normal right eye, left eye, and this is the actual subject's patient's responses. You see some depression in a few areas. And what I'll always look at is when I look at it compared to the average, I look for pink showing up here, which is less than 3 significant standard deviations decrease in response. And then a year later, we start seeing maybe some loss, some retinal thinning here on the OCT, and a little bit less on the left eye. And then 1.5 years later, because of that change, we got her back a little sooner. Maybe there's a little bit more progression here, and you see maybe a tiny bit worsening of the multifocal ERG, the same areas that we were looking at. The time changes are not significant. They look, slightly worse, slightly better, not a whole lot different. And 1.5 years later, you're comparing everything on one image. And then she came back just a few weeks ago, 3 years later, and exactly the same patient. Responses are all normal. Everything looks good. In fact, this green shows that she's even hyper responsive in some areas. Thoughts, questions, comments? I think I stuck to my 4 minutes.
Great job.